When a patient comes in, we talk about what we're going to do. We start off with talking about the TIF, the transoral incisionless fundoplication. And fundoplication just means we take the top of the stomach, called the fundus, and we plicate or suture it onto the esophagus to create a cuff. So think about a cuff on your dress pants. It brings it up and folds stomach around the top of the esophagus so that when the stomach fills, it puts pressure on the esophagus and closes it and creates that valve-like effect. Now the second part we talk about, if they have a hiatal hernia, is to go in and repair the opening of the diaphragm where the esophagus passes through. Because if it's not closed enough, then the stomach pushes through up into the chest and the valve doesn't work. The negative pressures pull it open instead of closing it. So the opening in the diaphragm is surrounded by two bundles of muscle, and they may be wider than they're supposed to be, and it creates an opening that the stomach can go through. What we do is we suture them closed so it's a narrow opening that's just the size of the esophagus so that the stomach can't pull its way up into the chest when you're having activities that increase the negative pressure in the chest, that vacuum the stomach back up into the chest. So by going in with little incisions, we can close that. Then we go down through the mouth and we do the cuff or the TIF fundoplication next. It's done all at one setting. Generally, you're out for about 2 hours, and then you spend a little time in recovery, and then you're able to go home.